Hey guys, this is Dr. Jean-Guy, and today I would like to talk to you about a subject that is quite popular among people, especially having some health issues, and is the problem of having a digestion issue. And some people might have some bloating, or some people might have acid reflux, or you might have heard of the term GERD, right? Those are all different terms that describe how a person will have issues with their digestion. And that's probably one of the easiest thing to correct, right? When you know what is the cause of that particular problem. So, from a medical point of view, the way that it's been handled for a long time is usually people will start taking some anti-acid medication, or they're going to be taking things like Prilosec, or they're going to be taking things like Tums to try to feel better, right? And I just want to kind of explain to you a little bit physiologically what's happening and what the body requires, for your body to be able to function better. And then how it all ties into your health and your immune system and all that. So just to give you a little bit of background, is your stomach was designed to be acidic. And what that means is if it's not acidic enough, then your body will not have the ability to break down the things that are coming in, and then to be able to push it to the next system, which is from your stomach, it goes to your small intestine, and then it goes to the large intestine. So this being said, when people are taking some anti-acid medication, what it does, because if the acidity is not high enough into the stomach, then what happens is the food that you're putting in will turn into organic acid, and it will start shooting back up. And that's one of the main reasons, the vast majority of the time, why people have acid reflux. It's not that they have too much acidity, but it's quite, the opposite, that most people don't have enough acidity, and as a result of that, the food is just going to rot into your stomach, and then it's going to turns into organic. It just turns around, and basically the food just rot into your stomach, right? I know that's not a great picture, but that's truly what's happening. And as a result of that, then the minerals, right, you're going to have a hard time for those minerals to be absorbed. Matter of fact, if you were to look at some of the side effect on those anti-acid medication, it's going to tell you that it's going to decrease the absorption of minerals, of iron, of calcium, and so on and so forth, because the stomach is not acidic enough. So this being said, right, some of you maybe have taken Prilosec or some of those medications, those proton inhibitors, for years. Some of you, maybe you've done that for decades. And I just want you to know that, hey, you know what? Number one is, if you choose to, that can be corrected, because that's a nutritional problem. And but obviously you have to make the choice, and you have to work with it, right? In order to, we already know that your digestive system doesn't function properly. And also what it does is, if your stomach is not acidic enough, is one of the first area where your immune system is protecting you. If it's acidic enough, there's a lot of the pathogen, by the time it gets to your stomach, that will be like, there will be a stop right there. Right? But if your stomach is not acidic enough, then what happens is those pathogens, those bugs, they're just going to keep moving on. So that's one of the reasons why, I know it's not a great description, but you see dogs that are just licking just about anything you can imagine, and yet they're not getting sick. Well, why do you think that is? Right? If you were to stick your finger into their stomach, you'd see that in a dog's stomach, right, the acidity is very, like, you touch it and you lose your finger. Well, maybe not that bad, but you understand what I'm talking about. So nutritionally, what we do is, when we assess a person, we can determine, right, what's going on with the stomach, if there's enough digestive enzyme in there, because there's your own body has the ability to do that, right? Your pancreas is going to produce some digestive enzyme. Your own stomach will produce some hydrochloric acid. But at some point in time, by the time you get to be 40 years old, the ability of your body to do this will start going down. And as a result of that, for many of you, over the years, you've lost your ability to be able to digest the food properly, and then it just gets stuck there. You go to bed at night, you get up in the morning, you feel the same as when you went to bed. You're still full, and the reason for that is because the food is not digested. So, this being said, the solution, right, how we can help is, this is what we do clinically with our nutritional assessment, is when we assess the person, we can find out if there's an issue with hydrochloric acid, if there's an issue with digestive enzyme, if there's an issue with sometimes both, right? So all those things can be, an issue. And again, by the time you get to 40 years old, the ability to produce digestive enzyme will start going down. And then as a result of that, sometimes people it will mimic some heart condition, because you don't have enough digestive enzyme into your stomach, right? Which is huge because people end up going to the hospital, and maybe that's you because you thought you were having a heart attack or something like that. But really what that is the inability of your stomach to be able to break down the food that is coming in so we can move it to the next system. So I just thought I'd give you a little breakdown today of like, hey, you know what? I know that can be a pain. The way that it's handled medically, they're not going to have any symptom. However, you do that long term, it's going to be causing some problem, right? And I know that many of you, you're just like, I'd like to do something else, but I don't know that there's any other option, right? So one of the options is to figure out, do I have a problem with digestive enzyme? Do I have a problem with hydrochloric acid? Do I have problems with both? And if you do, how can we correct that? And can that be corrected nutritionally? And the answer is yes. So at our office, right, this is what we do nutritionally when we design a clinical nutrition program. That's one of the first thing that I look at on every patient, right, is to make sure that the digestive system is functioning properly, because guess what? This is your first tube in your body. And if that first tube is not functioning properly and your body is not breaking down the food the way it should, then number one is you can't get the nutrient. And then number two is the ability of your immune system to function the way it should will be impaired, will be also affected. So this is the conclusion, right? If you've been taking those medications for a long time, I say to you, you don't have to. Right? And for most people, they don't have to do that if you choose to. That's completely up to you, but we have a solution for you. And if this is something that rings true to you right now, right, you just give us a call here and you schedule your appointment to have a nutritional evaluation done so we can figure out, right, exactly what your body needs nutritionally so you can start digesting the food better. And then as a result of that, then your body can process the food, can assimilate the food, you can enhance how your immune system function. So there's a lot of, great benefit to having a digestive system that is functioning properly, right? And some of the signs and symptoms is some of you can have, you can be bloated, you can feel nauseous when you eat. Some of you have acid reflux, or you have GERD, or you have heartburn, or you have multiple of those things. And like I said, this is things that we see on a daily basis in our office, and we can help you with that. Not just you, but if there's people that you know that are struggling with those things, you just give us a call. So our phone number here at the office is 517-336-8880, 517-336-8880, and just schedule your nutritional evaluation so we can get to the bottom of it, getting to the cause, right? I always tell people, I'm like, hey, you know what? Even if you were to take a pill for your acid reflux and the acid reflux is better, is the problem still there though? It's like me telling you today that people are having headaches because they don't have enough aspirin in their brain. Is that it? Of course not. Do people have acid reflux because they don't have enough Tums in their belly? Of course not. There's probably a reason. There's a cause, right? We want to get to the cause. So hopefully this was helpful for you today, and we'll see you soon. Take care.